Hi everybody, welcome to our show. Today I am beyond excited about talking about a topic that we don't talk about very often as women. And to be honest, I didn't really know much about it until I met my two wonderful experts that are here to talk about. And we're going to be talking about women's pelvic health, and for a good reason. Because like anything in our body, when we get to perimenopause and menopause, things start to possibly not work as well as perhaps they worked prior to entering into peri or into menopause and beyond. So ladies, I want you to introduce yourself because we're gonna have a very open and frank discussion about pelvic health and what we could do to help ourselves as we age. So why don't you introduce yourself, Christine?
Hi, I'm Christine Matheson. I'm a naturopathic doctor, and I'm also an Arvigo practitioner, which is an abdominal massage technique that we're going to talk about more today. It's also referred to as uterine massage. And I really became focused on women's pelvic, digestive, gynecological, and fertility health because I think that it absolutely has a ripple effect on their entire health. So for me, if I can improve their belly health and really expand and amplify that, it has a huge effect on their mood, their mobility, their intimacy, and many elements of their life. So.
Which, by the way, we see a change in all of those things you just mentioned when you enter into perimenopause and menopause. So I'm excited to delve into that. Claire.
I'm Claire Yorston. I'm a registered physiotherapist, and I work in orthopedic and pelvic health. And I see women of all ages and really work with women of all ages. And I find that women and men with pelvic floors can all benefit from seeing a pelvic health physio. We often don't think about our pelvis, don't think about our pelvic floor muscles, and especially going into menopause and perimenopause, it becomes that much more important to start thinking about these things so that those issues that you're having, like leaking with coughing and sneezing and maybe pelvic organ prolapse, maybe you can start finding some solutions to help you with some symptoms that you're experiencing.
You know, I like that you're saying that because for me, I really noticed a big difference in my pelvic health was after I have 3 kids and I delivered all of them vaginally, and my husband, he is jokingly and lovingly refers to me as leaky because really, I mean, if I sneeze or I can, doing those jumping jacks or any type of heavy movement, I guess, or like up and down movement, I tend to leak my pants. And it's embarrassing to think about it, which is why incontinence is such a big category for a lot of companies out there and who are giving us products to help, if you are leaking your pants, like the diapers. And you think, when I think about this, it's like, gosh, it makes us feel like, you think of it as such an old person. But, really, after you've had children, or I'm guessing it starts somewhere around there. If you've had children, especially vaginal births, it can start, right after that, right? I'm guessing is probably the time. And why does that happen?
So I find the pelvic floor and the 3 other muscles that it works with, anytime they're impacted by increased pressure. So that, especially with pregnancy, right, that increased pressure, but with chronic cough, say you're coughing for a prolonged period of time, or
chronic constipation.
Yeah, persistent constipation, same thing. You're always pushing down on that pelvic floor and impacting the pressures in your system. Makes it that much harder for the muscles of your core 4 system, which we can talk about later on. Makes it that much harder for them to function properly and give you the support that you need.
Let's start. You have an awesome prop here. Let's start from the basics. Explain what it is and kind of what we should be aware of.
So this is what I tell to all of my clients, and I always bring out this model, this lovely pelvis, and this is our bony pelvis. Okay, so it's basically 2 butterfly-shaped bones.
We're just taking the organs out.
Yeah, just putting them on the table here.
Okay.
Basically 2 butterfly-shaped bones that meet at the front here, and this is your pubic symphysis.
Okay.
And they meet at the back, and this would be your sacrum, and then your coccyx right at the bottom there. And your coccyx is your tail.
That's like the tailbone, right?
Exactly.
Okay.
Right. The pelvic floor muscles are basically all of the red that you see on the inside there.
So it's underneath all of our organs, kind of sitting at the bottom.
Like a basket holding everything up.
Yeah. And you can see it from the outside here too. And the pelvic floor muscles, they insert from the front all the way to the back to the sacrum and the coccyx. The functions of the pelvic floor, there are 5 of them. Okay, and I always talk about this with my clients because people, they don't think about their pelvic floors. First one is support. Our pelvic floor helps to support our pelvic floor organs, right? So we have our bladder at the front.
So we're going to put them back in.
Yes.
But that's good because it's one of,
We'll take them back out after.
Okay.
We have our uterus and our vagina in the middle.
Okay.
And that sits right behind the bladder there. And they're very snug.
I was just going to say, I want you to all notice how close everything is. So if you cross your legs a lot or you're not
as I'm doing right now,
you're starting to scooch that area and tighten that area even more. So a lot of the work that Claire and I do is to really create more space and more flow in that area. So already we're working with a lot of vital organs in a small concentrated area.
Okay. So put in the other organ, and then I have a question.
The rectum, and it sits right behind the vaginal wall there. Okay. And again, very snug fit.
I'm going to show it right to the camera so you can see how close everything is. So interesting. So you're talking. So there's our bladder right over there at the bottom. So you're saying when we cross our legs that everything is kind of, you're scooching it all together. You're kind of like pressing everything together, compressing it all together. And then that's what happens as we age. So take us through the process of what happens as we age and why we start to leak. I think that would be kind of an interesting.
So that's another function is actually that sphincteric control of our muscles, right? So around the urethra, there's in the second layer of pelvic floor muscles, it's our sphincteric muscles. And when we want to hold in urine, maintain continence, they contract. And when we want to release that urine, they allow us to pee or release the urine, right? What can happen is those muscles can become weak and they won't necessarily contract as much as we want them to. They will cause us to leak if there's, say, an increased pressure, like with coughing or sneezing.
And the sphincters are very connected to the nervous system as well. So if someone is under a lot of stress, we all know, out socially, if you feel the urge to go to the bathroom, you don't always follow that urge, or you can't. And so our nervous system is very connected to it. It's almost like little imaginary beings, sort of like, yep, it's okay to go. No, it's not okay to go, right? That's what the sphincters are doing because they need to make sure it's okay from a nervous system point of view. So if you're also holding a lot of your emotional tension in your abdomen and your gut and your pelvis, where we have a lot of nerves, that could affect the flow and create more pressure.
I know somebody who, she's close to 70, and she's afraid to go in public, like go on an airplane or go somewhere where she knows she isn't very close to a washroom or a bathroom because she's afraid she's going to pee in her pants. So that, I'm guessing now, it makes sense what you're saying about the nervous system is that it kind of becomes that catch-22 is that it's the weaker muscles, and then it's the stress and the nerves about going out in public, about leaking your pants, and it kind of is all interconnected.
Right. It's a fine dance between not holding it too long and also not responding to every urge, and learning how to create that relationship with the pelvis and with the bladder and with bowel movements.
What was that emotional component, which is so important that we're aware of. So you were saying, Claire.
An important point I want to touch on is that weakness doesn't necessarily mean loose. It doesn't necessarily mean a lengthened tissue. It can also mean a tight and shortened tissue. Right. So I always give the example of a bicep because it's really easy to see. Nobody can really imagine their pelvic floor muscles, but most people can imagine a bicep muscle, right? So if I have a really tight bicep, I can't straighten my elbow out kind of more than this. That's not necessarily going to be super functional, right? Like I'm not going to be able to straighten out my elbow. I'm going to hang around like this. I'm not going to have a super strong bicep curl. Correct? If I can release that tension, and typically we do that with diaphragmatic breathing, deep breathing, right? If I can release that bicep, I have all of this muscle available to me. I can get to that optimal length of contraction, and then that's that much stronger to kind of do that bicep curl with. Pelvic floor is the same thing. So if I have a tightened pelvic floor, and whether that's from stress or from kind of that fear of leaking, I'm always contracted, I'm here and I can't squeeze any further, so that pee is going to come out.
Oh, I didn't realize that it's also for tight muscles. I was always thinking it's loose, so it can actually be, I guess it's on both sides of the scale, right? So it's kind of that having that.
Absolutely. Yeah. And I think that that's a really good misconception to clear up, and a myth. And so a lot of the work that I do as a naturopathic doctor, and I'll talk about a technique that I use, but I'll often refer to pelvic floor physio because we need to assess first. And I would encourage all women to have an assessment of their pelvis first to see, is it because the muscles are weakening? Is it because they're too loose, or is it a combination of things happening? Because some things can be happening on one side different than the other side. And
so when you say have an assessment, so it would be going to your doctor, healthcare provider, and saying, I'm having these issues. So where does it start? It starts where I'm having these issues, I'm leaking, I feel like I have to go to the bathroom. I know you mentioned that before, Claire, before we went on camera. You were saying if you actually pee a lot, that could be another sign or symptom. So you go to your healthcare provider, you're saying, I'm having these issues, or do we call someone like yourself, Claire, be like, okay, I need some physio because that'll help me I think it's important that we explain exactly, because you're saying start with the assessment. Is Claire the person that we would go to?
I think
for
a
that
pelvic
assessment?
floor assessment is really now the gold standard for pelvic health.
Okay.
And I'm glad that it's better known. And it's actually ideal sooner in your life. And then even if you do choose to have children, during pregnancy, then postnatally, because you're trying to prepare the pelvis for all stages of its needs and all requirements that it has. So, pregnancy and birth are a major marathon for the pelvis.
Right. So we go to Claire. Claire does an assessment. Explain quickly what you do as an assessment, and then Christine, I'll have you continue. I want to keep it very, organized in kind of how we're doing it.
So I'll say I actually see two different types. Some people go to their doctor first, which is totally fine, and then they get referred to me, or they come directly to me. They've been recommended by a friend or their daughter to come see me. Kind of come from a multitude of areas, right? During the assessment, I always say that nothing has to happen if you don't want it to happen, right? Everything is with your consent. We do a ton of questions. I ask a ton of questions to my clients just to figure out kind of what's going on, what symptoms they're experiencing, and what they want to get out of physio, because that's kind of the ultimate, right? What are your goals? What do you want to achieve here? And what can I help you do to achieve that goal, right? Then I do kind of a head to toe exam. I always do a functional exam to see kind of how they're moving, kind of neck down to toes. Where are they kind of showing some imbalances, some more tension elsewhere in their body? Right?
Okay. Because chances are if there's tension there's going to be tension elsewhere. And I know you said there was a big connection between the jaw.
Totally.
Oh my gosh, this was so interesting that there's a connection between the jaw and our pelvic area.
Yeah, I don't know if you want to talk about it yet, but
I think we come right back to it. Let Claire let that, because this is fascinating. So please, stick around, because this is fascinating.
Yes. I always talk about kind of pelvic floor education as well. So I go through what the functions are, what can go wrong, and kind of what we want to do to improve those issues. Okay? And then after that, I talk about what a pelvic floor exam is. I explain every step of the way, and then we, with their consent, proceed to an internal pelvic exam, which can include a vaginal and a rectal exam, to assess what those muscles are doing internally, whether they can relax fully, and whether they can contract fully under a variety of different circumstances. So quick contractions. If you're coughing, can your pelvic floor come on quickly to prevent that leaking, right? Are you able to relax fully between those contractions and kind of let that muscle go through the full excursion, right?
So
can you find those muscles at all, right? So a lot of women are like, I don't know how to contract those muscles, right?
That's huge, right? And that awareness just isn't there.
And so it's an internal exam. How do we, our community, how do we know how to choose the right physiotherapist for this? Because obviously that word of mouth is crucial, I would think, obviously, but what are some other ways that they could find someone that they can trust? Because I think this is an important thing to talk about.
And I think there's a certain level of training to be able to do what you're doing.
Right. It's not like we can just go to any physiotherapist.
So you're looking specifically for
a pelvic health physiotherapist. And a physiotherapist who specializes in pelvic floor physio, we have to do designated training after we graduate from a physiotherapy program to be able to provide this. And then we have to roster with our college to be able to do internal exams. And if your physio doesn't have that, then they cannot do any internal exam.
Okay, so let's go back now to the jaw and the pelvis, because you light up. I love this. It's so great to see, because first of all, it's such a cool topic, right? And I'd love to know in the comments below if you're experiencing any type of tightness, or maybe it's the looseness. Are you leaking? Can you use a trampoline? Can you do your jumping jacks or star jumps, as they call in Australia? So we'd love to hear in the comments below. So please join the conversation. So let's hear it, Christine. What's the connection?
Well, I discovered through the work I do, so I should say that I, as a naturopathic doctor, I was really fortunate to be one of the first naturopathic doctors in Canada to work in a hospital setting at a clinic called the Women's Pelvic Health Center. So that's where I came to this world of pelvic health. And I definitely have developed unique techniques, which we can talk about. But one of the discoveries that I had early on, and actually came up when I saw an osteopathic doctor myself, is they explained to me there's a strong connection physiologically between the jaw and the pelvis. And so I started to track my patients, and I noticed that so many of the women coming in for pelvic health or gynecological issues, or even digestive issues, would complain about jaw tension, having been diagnosed with TMJ or something related to that, or being told that they're grinding, or there's signs from their dentist.
You have to wear like a mouth guard at night.
And so what we know now is that there's a physiological connection between the jaw and the pelvis. So I wrote a whole blog about it, which is now like my most popular blog, because so many women were like, oh, I didn't know about that connection. So you mean I need to really see the interconnection between these? And that's really an important point in general in naturopathic and holistic approaches, is seeing the interconnection. So although we're talking about the pelvis, this is how it connects with the rest of the body. You know, it connects with your jaw, your movement, and other parts of your body. So it's so critical to relax that area. If you're doing, receiving pelvic floor physio or doing the exercises at home, make sure you're not then holding tension somewhere else.
And, you know, it's something that personally I would never have thought of, that there is that connection, but it makes sense because of the meridians in the body and how everything is connected, right? So it actually makes sense when you think about it. So that's pretty fascinating research, and we definitely would love to learn more as you continue with your clients and learning more about that.
And I can link my blog that got
Yes, please. We will link that below to Christine's blog. That's pretty amazing to hear that. You know, one of the things that I think is important that we talk about too is, what about when it comes to pelvic floor health for women who've had hysterectomies or women who have never had children? So would the same apply to them that they'd had? Okay, so tell us a little bit about that.
So I think it's really important to say that, because at any point in a woman's journey, we want to support the health and vitality of the pelvis. The work that I do, which is a good segue, is that I got trained in a technique called Arvigo massage, which is an abdominal massage, which I both give to patients and I teach them how to perform on themselves. And it comes from an ancient Mayan tradition of healers in Belize who believed that the woman's uterus was her core, and if that was out of balance, her whole life and her whole self was out of balance. And they believed that the pelvis was the powerhouse, or the throne of, you know, where we create babies, where we menstruate, where we
I can see that, by the way. I mean, that's what we have that's so special, right? That we have.
Right. And so
that's how we bear babies.
Exactly. So no matter if you do bear babies or not, you want to keep that area very vital and healthy through improving the stability and support that it provides, but also the flow. So what I do is this Arvigo massage technique. Through the work I do as a naturopathic doctor, I combine working from the inside out, getting them healthy and eating the right foods or taking the right supplements, but also breaking down those tension patterns, because we now know there's a high concentration of nerves in the whole abdominal pelvic region. In fact, we call it, you know, the gut brain. And so many of us can hold our emotions there. So I massage many women's bellies and it brings up a lot of emotions. So if, for instance, you're perimenopausal or menopausal and there's a lot of change going on in your uterus, you don't want there to be stagnation or congestion. You want to keep it vital and allow there to be more flow of blood to the area, more lymphatic flow, and from an Eastern tradition, more of the chi or energy flowing to that area, and literally making sure it's better aligned. So that's why we do the stability work, making sure we're also loosening the glutes, making sure the lower back is supporting and relaxing at the same time. So it's a very holistic approach, and I think it is important to say that no matter what point in your life as a woman or as a man, your pelvis should be something that you're thinking about and considering and giving it proper attention.
So women and men can get this massage?
I perform only on women, but it is available in other parts of the world, and I know in the States some practitioners offer it to men as well, because men do experience pelvic health issues. We've got a few male patients also between us, and these are, you know, but it's a big topic for many people.
So women who've had hysterectomies, I have a friend who recently had a hysterectomy, and she was saying how she could really feel how everything inside has just been changing and moving. So what would you recommend if someone's going in for a hysterectomy or has had one when it comes to pelvic floor health? And I'd love to hear both your answers, actually. Claire, let's start with you, because I think you both have such a different, you do similar things, but yet so different.
Yeah, we complement
each other so well,
What I would say is, imagine you're going going for a knee surgery. Like, you're going to do your prehab and then you're going to do your physio rehab after. And the muscles of the pelvic floor are the same as any other muscle in your body. So if you're going to have a hysterectomy, that's a surgery, right? And you want to do your prehab. You want to make sure that your muscles are functioning as best they can leading up to that surgery to give you that support after, and to give you almost like a jump on the rehab after the surgery as well. And then when it's appropriate, I believe it's about 12 weeks after a hysterectomy, you can start physiotherapy as well after, to make sure that those muscles are supporting you and giving you the strength and relaxation that you need to kind of function appropriately, right?
Wow. No, that is so important. It's like Christine and I, we've been talking about providing you with solutions and things that you can ask your healthcare providers. And this is one of those things that I think it should be an absolute must, that if you are going in for hysterectomy, I love that idea. Seeing, pelvic floor physiotherapist, or getting an Arvigo massage as well. Does that work
so as a naturopathic doctor and an Arvigo practitioner, I would probably want to do some work. First of all, with preparing the body for the surgery, so making sure we have the right supplements and nutrition in place to make sure that they have a healthy recovery and a more swift recovery. And then the Arvigo massage would be useful to do to make sure they're going into the surgery with less constriction in that area and more flow. Really what we're trying to do is create stability and flow in that area. So in a post-surgical situation, we'd also wait a certain amount of time for the natural healing process to occur. But we can have scarring from surgeries and adhesions, and those can cause displacement and tension and congestion. So we'd want to get back in there, having the patient do the massage on themselves and me giving them treatments, or an Arvigo practitioner doing treatments to keep, again, that area, blood flow, circulation for healing to happen, lymphatic drainage, all of the necessities.
We exercise our bodies. So it makes perfect sense that we would have to exercise our pelvic floor muscles as well. So we're going to the gym, or we're working out at home, or we're going for walks, or whatever it is we're doing that helps to strengthen our muscles. So from a pelvic floor standpoint, it makes perfect sense that we should be exercising those muscles too. And I do want to talk a little bit about, when we're in perimenopause and we're in menopause, there are other things related to our vagina. So for example, like having sex, that might be, whether we're too loose or whether we're too tight. So these are really important things that I think we need to talk about, because it could be embarrassing for people. So that's why we have this show. That's why we have our amazing experts, because we are not afraid to talk about it, and we have to bring it up into the open, because if we don't, so many of us are suffering in silence, right? And we're like, wait, why is this happening to me? And is this normal? And so let's talk a little bit about that, and when it comes to sexual health, because I think it's important.
I don't know if you go ahead.
Go ahead. Yeah. So one of the main functions of the pelvic floor, one of the 5, is actual sexual function.
Okay.
So if we're holding a little bit too much tension in our pelvic floor, and that can be from stress, that nerve innervation, right? Kind of always gripping that area, or if we're fearful of leaking, a multitude of reasons, right, can cause us to hold that stress or tension.
Right.
That can lead to painless sex, right? It's not the only thing that can lead to painless sex, but is a major kind of impact and factor that can impact the pelvic floor, right?
Okay.
If we have not enough tension, it can actually lead to a lack of sensation and a lack of orgasm.
Right.
So we want a certain amount of tone in the vaginal canal to be able to enjoy sex, but not to the point of, okay, now this is painful, right? Mm-hmm. And being able to fluctuate during different parts of the sexual encounter, different times, different amounts of tension, right?
Mm-hmm. No, just before, I don't know if you were going to continue, but Christine, talk a little bit about, I want to understand why that happens. What causes vaginal dryness? What causes the hormonal aspect? Because I think that's an important thing for us ladies who are at this stage in our life, is all these changes are happening to us, but we're like, wait, why? What's going on? So maybe a little bit of an explanation of that, I think, is needed here.
So there's hormonal changes going on if we're pertaining to perimenopause and menopause, which is what we are. And I think what happens is you have a drop in estrogen that starts to happen as you get closer to having your menstrual cycle stop. And that estrogen is responsible for a lot of the lubrication in the vaginal area. Yeah. So you're right. A woman could be experiencing changes not just in the structural sense, but also from the tissue level. So they might experience dryness, which can lead to more pain during intercourse, more friction, more difficulty with that. And so looking at the world of natural lubrication and how do you lubricate your body from the inside out, for instance.
Very important.
Yeah. So for instance, making sure you're taking enough fish oils, you're eating enough healthy fats.
Drinking. I think hydration is a big part of it.
Absolutely important. But then there's some concerns about all the different types of lubricating products that are available as well, if you're going to use those, because some of them do contain ingredients that are less desirable or toxic.
We want to stay away from parabens and phthalates and colors. I know you see them in a lot of them.
Yeah.
So it's really you mentioned that there's a brand that is completely clean.
Yeah,
right?
a dear friend of mine, Nadine Artemis, has a line called livinglibations.com, which is an amazing line of many products, but she does have what she calls love butters, which are very natural and pure.
Yeah, amazing. We'll link to it below.
Yeah.
Awesome.
But to comment on that, I think, too, when you were saying, when you go, we try to exercise and take care of ourselves, but if the core pelvic floor muscles are not healthy, you can actually injure yourself, especially as you get older too, because if that stability is not there, you can put your sacroiliac joint out or hurt your hips or things like that because you don't have that stability to start with. So I think it's really important to incorporate some type of pelvic floor exercises. Breathing work is so important with that too, because the diaphragm moves as we breathe, and that affects the pelvic floor.
Only another good reason why deep breathing is amazing for us, right? Like there's like a million just added to the checklist of why it's so fantastic, on top of like just relaxing us and so many other benefits, which I think is great.
Yeah.
It's so true.
It's so true. So I think that, starting with that, now that I have more awareness by working with pelvic floor physios and doing this Arvigo massage, often before I start doing any form of exercise, I start by just checking in. Is my belly relaxed or is it full of knots? Have I got some pelvic floor support happening before I'm going to lift anything heavy or do any exercises that require
Being more mindful.
Absolutely. And integrating the breath with that. Yeah.
Now, Claire, I know you wanted to talk about something specifically, so please.
Yeah, so it touches on kind of what Christine mentioned just briefly now, the pelvic floor and its core function, right? So the pelvic floor actually works with 3 other muscles, diaphragm being one of them, which is one of our main breathing muscles, and that's why those gentle, deep breaths are so huge. Usually when we think deep breath, we think, right? But we want to actually activate that diaphragm, let it come
So let's do it together. Want to take us through it? So let's everybody just relax in your seat and or if you're standing or
uncross
sit down.
Your legs.
Uncross your legs.
Yeah.
Okay.
Even bringing your knees a little bit wider than your hips, right? To give you a nice stable support.
Okay.
You can think of untucking your pelvis, sticking your bum out just a tiny bit. Okay. So you're not kind of rounding out through the lumbar spine.
Okay. So tucking it out. So
relax your jaw.
Relax through the jaw.
Okay.
You're going to inhale softly through your nose. Good. And then exhale through your mouth. And as you're doing this, a couple of different cues that I typically use with my clients are you can imagine your ribs opening 360 degrees. And it's always a gentle breath, right? We don't.
Is that visualization of it opening?
Yeah. Visualization of the ribs opening 360 degrees. You can even imagine a flower blooming out of your vagina on the inhale. That helps too. I'm serious. People always laugh when I say it.
No, but it's great. I'm like, Let's do some pictures we took recently for a photo shoot. We're like a picture of her. All right, let's do that.
Flower bloom breath. You're imagining that flower blooming out of the vagina on the inhale. And on the exhale, you're just going to maintain that bloom. Just let it stay nice and open. Good. Usually I give people to do this like 4 to 5 times a day, 10 breaths. And that can be done anywhere. It doesn't have to be lying down on your back in that perfect position, right? You can be sitting, standing, before seeing a client.
Driving. Just be careful, of course.
Right? Yeah. And you can kind of bring it in throughout your day, so it's not this, I have to make the time to do this. It's more of, I'm going to use this when I feel that my body needs it. Right?
And it also make you laugh. Think about flowers out of your vagina when you're driving, and the people next to you will be like, wow, I want what she's having.
I have another one. You probably know this one too, but I have a few people in this field that I follow, and the idea of holding a blueberry with the opening of the vagina. Or my favorite one is imagine a straw, like you're drinking a smoothie through the vagina.
Yes.
So you're pulling up, which creates that
that contraction.
Absolutely.
Yeah. So this would be the
really
core
funny.
breath, which kind of brings in our other two core muscles that work with our pelvic floor. And that's our innermost abdominal muscle, that transverse abdominis. It wraps around us like a corset, basically.
Okay.
And then our multifidus, which is a back muscle that goes kind of down our vertebrae, attaches to each vertebrae, little slips, and it goes up and down our spine on either side.
Yeah.
So
That's
Christine mentioned the blueberry, and that's actually part of the core breath, right? So it's similar to the diaphragmatic breath that you're inhaling, you're releasing the tension, right? But on the exhale, you're thinking about contracting, and that's a strengthening of that muscle. And I'm doing this because the pelvic floor contracts and then lifts up a little bit when it's like doing a full, strong contraction.
So how does, my sister-in-law was telling me that she does kegel exercises. So is that a good thing? Is that not? How does that tie into what you're talking about?
Totally depends.
Okay, so I was kind of thinking, well, maybe it's not, tell me. Yeah. I'm curious. Tell us. I so want to hear.
So it totally depends on what your pelvic floor is doing at its baseline. If you're holding that little bit more tension, doing Kegels over and over again, you're not necessarily relaxing that pelvic floor. So that can lead to issues and a little bit more
of being too tight, what you were talking about.
Yeah, exactly.
Yeah. So some women have difficulty with the release. So when I was first taught about this too, you could also picture it like an elevator and there are floors. So when you are, imagining contracting those muscles, if it's like the smoothie and you're using the straw, you don't want to do it as one big motion. Maybe you want to do it as stages or floors of an elevator. And then the real trick is, can you slowly descend and relax that muscle instead of, right? You want to feel like you can slowly relax that muscle. Right?
Everybody here is looking at the back is everybody's laughing. I wish you could see all of them.
I'm just trying to make it real.
I don't know. I'm just trying to wrap my head around drinking a smoothie from my vagina, but I'll get
Some people like visualization. So.
No, actually, I'm just joking. It's great. No, but I love it because we're talking about it, and that's the key, ladies, is we're talking about it. So,
and I had a story about that we were talking about a moment ago. So when I have 2 children as well, 2 vaginal births, and after the adventure of having given birth my first time, I showed up for a postnatal yoga class, with my babe in my arm, and the woman looked at me and said, "Are you having a vaginal identity crisis? Because if you are, that's totally normal." And it was so gratifying and also overwhelming when she said that, because I didn't know a lot about pelvic floor physio at the time. And I think if a woman develops a relationship with a pelvic floor physio, as well as doing Arvigo massage, and gets connected to that part of their body, if she's planning on having children, or even if she's not, any change that happens, she'll have a connection, and it won't be starting from square one. They'll have established that relationship.
Right, which makes a lot of sense.
Yeah.
This has been such an interesting conversation. Is there anything that we didn't talk about that you want to mention or bring up?
Well, I personally think what this also brings into the discussion is the whole idea of self-care, which is that a lot of the techniques that we're talking about, you need an assessment or an expert to help you do an assessment and guide you. But a lot of this is about simple self-care techniques that you're going to practice at home. So
I love that.
Knowing that you're going to do that and the power that has is really important, because I don't want to have any of your viewers be overwhelmed by this. Get an assessment, get some support, but then little incremental things that you might do for, the massage that I recommend is less than 5 minutes a day. The pelvic physio exercise is also very minimal, but they make a huge difference. So the small changes you make can make huge shifts. It's like Maya Angelou says, when you know better, you do better. Right?
Favorite quote. Love Dr. Maya Angelou.
So I think that I feel like I don't want pelvic health to be something that women find out about too late in life, because there's so much they can do. But even if you find out late, there's so much you can do.
Which, Claire, that reminds me, because Claire was sharing a story before we went live or went on camera, and she was saying that some people ask her if it's too late once we're in perimenopause and menopause, and your answer was?
Never too late. Never too late. I often see a lot of kind of women in the perinatal period, and they say, "Is it okay if my mom comes to see you?" And I'm like, totally, right? We can help women of all ages, and it's never too late to kind of get the support that you need.
Yeah, and I think we were talking about, our mothers or our grandmother's generation just accepted that after they gave birth, they'd have to deal with urinary leakage or issues like that. But that's not the truth anymore. We know we have better tools.
Which is why we are doing this show and why we have our website, which is this makes me so happy, and I do want to touch upon one thing before we do end is rectal, like prolapses. So vaginal prolapse and a rectal prolapse, because I've heard the terminology, and uterine. Okay, so I've heard the terminology. I know somebody recently who was having issues with she was leaking from her rectum, and it was so stressful for her. So talk a little bit about, again, why that happens. I know we've talked a lot about that, but also what we can do and what it is.
Yeah, so prolapse is a descent of any of these organs kind of pushing into the vaginal canal, dropping into this vaginal space. Right?
So the muscles on the pelvic floor are weak, and it's okay. So I understand.
It can also be tightness, right? And that can lead to symptoms of heaviness or bulging, that pressure on the pelvic floor, and usually that is increased. Usually that's increased with kind of gravity dependent positions. So you stand up in the morning, you may feel a little bit of that heaviness, but then as your day progresses, maybe you're walking around a little bit more, maybe you're jumping, that pressure heaviness is going to increase.
So it's this muscle, just so we know, what you showed us in the beginning is coming out. Is it?
So it's the muscles that are weakened or tight, and it's the organs that are actually descending and pressing into the vaginal canal here. Okay,
so those organs.
So they're very closely connected. This would be the vaginal canal here. Okay, and then the bladder sits at the front, and that would press into that area. It's like the walls are like this. Okay, right? So it pushes into that wall.
And I want to add, too, if you are menstruating, your uterus is dynamic. It's constantly changing size. So this organ is unique in that sense. So as the uterus fills with the lining of blood, it doubles not only in size, but also in weight. So that can change. So the pelvis is also very dynamic in that sense, because the rectum, it has stool sometimes going through it, which is for your bowel movement. So keep in mind that it's not this perfectly static space. There's a lot of dynamic movement and change happening all the time. And if you have gravity against you, or a lack of stability or strength in that area, or pressure, that starts to make those organs start to drop, essentially.
And so, again, is that the estrogen that's come? Is that because we have low estrogen?
It's a bit connected to that, but it's a more structural issue to start with.
So so we can go see someone like yourselves, and doing everything we just talked about today can actually help strengthen those muscles. So if you are experiencing any type of prolapse, that would be fair to say.
And the Arvigo massage I refer to, it's like a pelvic uplift, like, instead of a facelift, it's like literally going to uplift that area and stimulate the area. So a lot of the motions that we're trying to do with the Arvigo massage is to really avoid that and to create the space in that area before that can start to happen. Which is why, again, if you start to see a practitioner, receive treatments, and have that daily treatment on yourself, those small little practices can be so preventive.
For Arvigo, is there an organization for our viewers that are all over the world?
Yes, arvigotherapy.com. And then you look for a directory to find a practitioner near you.
Okay, that's easy. And Claire, I know you mentioned that you can go. Is there a registry? I guess that was the word I was looking for.
So I know there is one in Canada. I'm sure there's one in the States as well. I'm just not sure of that kind of regulatory.
We'll try to find it. We'll find it for you. And then you'll give us the Canadian. What's the Canadian registry?
The Canadian registry is pelvichealthsolutions.com. And that's where all of the pelvic health physios do their training through in Canada. So everyone registered on that website has done kind of the appropriate training.
Right.
Amazing.
It's a great site.
What I'll also say, just before we go, is that pelvic health physio is actually gold standard treatment for prolapse and pelvic organ prolapse, and it can help to improve it by 1 to 2 grades.
What does that mean, 1 to 2 grades?
So prolapse is graded by 4 grades. Fourth being kind of a full inversion, full kind of coming out of the vaginal opening.
That's
of that organ.
That's the worst.
1 is the least, it's just a small descent into that vaginal canal. And the pelvic floor physio can help you kind of improve that grade by 1 to 2.
Which is pretty big considering there's only 4 grades.
Yeah, exactly. So,
and it can make it so that it's asymptomatic, right? So you don't necessarily notice. If it's a grade 1 and you're not noticing any heaviness, pressure, or any symptoms, then that's okay. That's totally fine to be walking around and living with that, right? If it's that pressure, heaviness, that's not something you want to be dealing with in your day-to-day life, right? It's not comfortable.
I'm just thinking about all the ads that I see on TV for women for, diapers. Like I'm going back now kind of where we started. And the cool thing is that there are things we could do to prevent it. So if you are if you want to wear them, that's perfectly fine. But if you do want solutions to not have to wear it, especially overnight, and women, when we get into perimenopause, especially in menopause, overnight, you're waking up, many of us are waking up overnight. I know what's one of the signs and symptoms that many of our viewers have told us that they're experiencing is you're going up to pee so many times in a night. So a lot, would this help the bladder as well?
I would say pelvic floor physio as a whole, right? And we can definitely work on bladder retraining. So there's a few different factors that can impact you and make you feel like you have to go all the time. One of them is the tension in these muscles here. They insert right kind of behind the pubic symphysis. Okay. And they sit basically right in front of the bladder.
So I'm going to show that to the camera.
So if there's tension there,
so it's these muscles right here, you said?
Exactly.
Okay, so these muscles right here.
If there's tension
and then
there,
the bladder sits right there.
It can make you feel like, oh, I have to go, even when you don't have to go. Okay. Another factor is if you're going all the time just in case, when you don't necessarily have to go pee. Maybe you're leaking, you're like, I don't want any urine to be in my bladder at all. I'm trying to go and get rid of it. The fact is your kidneys are always producing urine, right? So you're always going to have a little bit. There's no way you could have a completely empty bladder, and we wouldn't necessarily want that anyway.
Oh, that's interesting. Right? I didn't know that. So it's always, your kidneys are always working to
So if you're
something new again.
always going to the bathroom when your bladder isn't kind of at an appropriate fill line, say kind of more than half full, then it's going to cue you to go even when you don't have to.
You actually bring up a really good point. Is I heard recently that someone was saying to train our bladder. So let's say if you have to go to the bathroom overnight, to actually hold it in. So I always thought that wasn't a good thing to hold our bladder, but is it good to hold it so that you're training your bladder to actually hold more urine?
I would say it depends again. Okay. If you're going every 2 to 3 hours, that's pretty typical. Like I wouldn't necessarily say you should hold it much longer than that, right?
Yeah.
If you're going kind of multiple times an hour or multiple times a night, that's when you can kind of stand really still, try a few of those diaphragmatic breaths, see if that urge is still there. If it's not, then see if you can delay by 5, 10, 15 minutes until you get to that kind of 2 to 3 hour mark.
And as a naturopathic doctor, I'd be looking at what does the evening routine look like? What does the diet look like? So how close to bed are you having a lot of fluids? Are you eating foods that could cause more of what we call a diuretic effect?
Like caffeine
or a herbal tea that tastes lovely but causes you to urinate more. So we look at assess all of that.
Fascinating.
Yeah.
I love it. Go vaginas.
Yes.
Go vaginas. Go vaginas. I absolutely love it. It's great. Thank you so much for having this discussion today. Very needed, and I learned so much, and I'm hoping you all learned so much as well. Thanks for joining us.
Thanks for having us.
Thank you. I think it's important to know that there are more options than the more drastic and severe options, which exist for a reason, and I'm grateful they do, but in terms of women who might need surgery or other, major considerations. But there's so much we can do from a preventive point of view and from a maintenance point of view. So I think, take care of your pelvis, please.
We absolutely have to. So thank you so much. If you enjoyed this video, please share it with your family and friends because we want to spread the word about women's health, especially in perimenopause and menopause. And if you like what you heard today, please give us a big thumbs up and ring that notification bell because it'll tell you every single time we have a new video posted. Thank you so much for watching. Stay well, and we'll see you next time.